In this video, we'll discuss mental health conditions, what they mean, and how they are addressed. Everyone has a mental health status, and it changes constantly. When we talk about mental health status, we are talking about emotional, psychological, and social well-being. Our mental health status can determine how we handle stress, how we relate to others, our behavior, and the choices we make. Different from this is a mental health condition. A mental health condition, sometimes called a mental health disorder, is a condition where you have a certain list of symptoms that affect your mood, thinking, and behavior. A mental health condition can develop at any time throughout the lifespan. Living with a mental health condition is a common experience. 1 in 5 adults in the United States experience some form of mental health condition within their lifetime. Many factors contribute to the development of mental health conditions, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse. Some conditions are situational and can be relieved with minor lifestyle adjustments. Others are more serious and can even be chronic, meaning those who have them will always need some form of support in order to live a healthy and balanced life. First, let's talk about diagnosis. If someone is having symptoms that affect their mood, thinking, or behavior, they may be referred to a mental health professional for an assessment and diagnosis once other medical conditions are ruled out. This assessment is similar to an interview where the professional will ask about medications, mood, stress, feelings, family history, lifestyle, symptoms, behaviors, diet, and use of substances such as drugs, tobacco, or alcohol. The challenge is that mental health diagnoses cannot be measured through biometric testing, such as blood tests or x-rays. So this interview with the client is very important to make an accurate diagnosis. Unlike medical conditions such as diabetes, cancer, or heart disease, mental health conditions are diagnosed based on the doctor or counselor's experience with that specific struggle, the symptoms that you report, the presentation of certain behaviors, and the family history that is available. A diagnosis serves several purposes, one of which is the ability for you to ask your insurance company to cover the services that you need, such as regular counseling visits and medication prescriptions. Experiencing one or more of the following feelings or behaviors can be an early warning sign of a mental health condition and could lead to a diagnosis. Eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, and finally, inability to perform daily tasks like taking care of your kids or getting to work or school. Remember, you are not your diagnosis any more than you would be with a broken leg. These conditions are terms to address a set of symptoms. Next, let's discuss what to do if you or a loved one receives a diagnosis. It is very important that you become informed and educated about the condition you or your loved one is diagnosed with. Take notes, ask questions, and seek resources to learn more about the diagnosis and how to best care for yourself or others. For most diagnoses, there are many options out there to choose from, and one size does not fit all. A diagnosis is only as good as the treatment that it leads to. Any treatment should provide relief from symptoms and increase satisfaction with life. A mental health professional, along with your doctor, will make the best diagnosis possible in order for you to receive services through disability, Social Security, or other forms of insurance. Over time, it is likely that the condition will change, and with good management of symptoms and healthy lifestyle choices, a mental health diagnosis can change or be reduced. It is very important to follow the treatment plan you are given and report changes in sleep, diet, mood, feelings, behaviors, and levels of pain to your doctor. It is not uncommon for people who are prescribed medication to need adjustments in dosage or changes of medication, particularly at the outset of the treatment. Discussing your progress regularly can ensure you are receiving the proper treatment and have the correct diagnosis. Support looks different for each individual and for each condition. It can be a combination of things such as regular visits to the doctor for medical tests and checkups, visits to community health clinics for mental health services such as counseling and therapy, self-help and peer-based support groups, inpatient treatment for stabilization like a hospital stay or an extended care rehabilitation facility, medication management, spiritual and religious community participation, holistic support such as following a specific diet, regular exercise and sunlight exposure, support animals, or practices like mindfulness, meditation, grounding, or self-soothing with breathing and other wellness-based activities. Unfortunately, many people become unemployed, homeless, or incarcerated as the result of their mental health conditions because they don't have the care that they need in order to manage a life with those specific struggles. Mental health conditions take a lot of work and personal responsibility to manage, but with certain skills and the right support, people experiencing mental health conditions, even serious ones, can live a healthy and balanced life, allowing people to realize their full potential, cope with the stresses of life, work productively, make meaningful contributions to their communities, and maintain healthy relationships with others. Now, we'll talk briefly about common types of mental health conditions or diagnoses. On this learning platform page, you can find handouts about these conditions for more information if it pertains to you or if you think it might. First, trauma and stress-related disorders, PTSD or post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, can occur after living through or seeing a traumatic event such as war, a hurricane, rape, physical abuse, or a bad accident. Trauma can also develop over time through childhood sexual, physical, or verbal abuse, or it can be experienced in adulthood. Many of these traumas are an all too common part of the prison experience, which places many of us at a heightened risk of PTSD. As discussed in previous video, trauma challenges the nervous system and affects the brain in ways that must be treated in order to heal. You cannot just get over it or forget about it because the trauma experience has changed the way the brain and the nervous system communicate with the rest of the body. However, with consistent support, trauma can be treated and healed. Depression and mood disorders. Clinical depression is more than life's ups and downs. Life is full of joy and pain, happiness and sorrow. It is normal to feel sad when a loved one dies or when you are sick, going through a divorce or having financial problems or have been incarcerated. Any big change like transitioning from a career field, moving to a new place, or retiring from a job can cause enough stress on the nervous system and the brain to affect the mental health of a person. But for some people, the sadness doesn't go away or keeps coming back, and a sense of hopelessness is present. If your blues last more than a few weeks or cause you to struggle with daily life, you may be suffering from clinical depression and could benefit from the support that a professional can provide. Bipolar disorder. Bipolar disorder is a mental health condition that causes dramatic shifts in a person's mood, energy, and ability to think clearly. People with bipolar disorder experience high and low moods known as mania and depression, which differ from the typical ups and downs most people experience. Contrary to how it is sometimes used in conversation, a diagnosis of bipolar disorder does not mean a person is highly emotional, but rather refers to someone who experiences extended periods of mood and energy that are excessively high and or iterable to sad and hopeless with periods of normal mood in between. Anxiety disorders. People with anxiety disorders respond to certain objects or situations with fear and dread. They have physical reactions to those objects or situations, such as a rapid heartbeat and sweating. We all experience anxiety. For example, speaking in front of a group can make us anxious. But that anxiety also motivates us to prepare and practice. However, when feelings of intense fear and distress become overwhelming and prevent us from doing everyday activities, an anxiety disorder may be the cause. ADD and or ADHD, attention deficit disorder, or attention deficit with hyperactivity disorder. People with ADHD show a persistent pattern of inattention and hyperactivity, impulsivity that interferes with functioning or development. Symptoms include inattention, impulsivity, difficulty recalling information, and difficulty managing and organizing. Sleep disorders. Many people experience problems sleeping, including not getting enough sleep, not feeling rested, and not sleeping well. This problem can lead to difficulties functioning during the daytime and have unpleasant effects on your work, social, and family life. Problems sleeping can be secondary to a medical illness such as sleep apnea or a mental health condition like depression. Dual diagnosis and substance use dual diagnosis, also referred to as co-occurring disorders, is a term for when someone experiences a mental health condition or illness and a substance use disorder at the same time. Either disorder, substance use, or mental illness can develop first. People experiencing a mental health condition may turn to alcohol or other drugs as a form of self-medication to improve the mental health symptoms they experience. However, research shows that alcohol and other drugs worsen the symptoms of mental illness. Finally, it's very important that we discuss something that many of us have personally dealt with, either for ourselves or with someone we know: suicide. If someone you know is showing one or more of the following behaviors, he or she may be thinking about or be at risk for suicide: talking about wanting to die or to kill oneself, looking for a way to kill oneself, talking about feeling hopeless or having no reason to live, talking about feeling trapped or in unbearable pain, talking about being a burden to others, increasing the use of alcohol or drugs, acting anxious or agitated, behaving recklessly, sleeping too little or too much, withdrawing or feeling isolated, showing rage or talking about seeking revenge, displaying extreme mood swings. Don't ignore these warning signs. Suicidal behavior isn't only intentionally taking your life. It can also mean engaging in behaviors that are so risky that they put your life at risk to the point of death. Suicide can also become an option rather than a conscious choice when other soothing techniques are no longer working or no longer an option. Get help immediately if you see someone with these signs or experience them yourself. If you or someone you know needs help, call the National Suicide Prevention Line at 1-800-273-TALK, 8255. Trained crisis workers are available to talk 24 hours a day, 7 days a week. If you think someone is in immediate danger, do not leave him or her alone. Stay there and call 911. Recognize, too, that there is a stigma around suicidal feelings, and there are a lot of untruths that people may hear or say. Here are some common myths that are dangerous. Myth: this person is just bluffing. Even if someone has talked about it but not done anything in the past, you don't know the truth about this moment. Myth: this person just needs to love themselves more. Self-love isn't enough healing in this moment. Myth: every suicidal person genuinely wants to die. It is important to understand that sometimes other options don't seem available, and this is what seems left for this person. Myth: you can't do anything to help this person anyway. You may not be solely able to help this person, but you can help to connect them to other resources or give them an ear. This video is full of difficult information, but it's important that we can talk openly about the struggles that many of us face. If you or a loved one is struggling, please seek help. If you see others in pain, be compassionate and try to guide them towards the help that they need. Prison is traumatic and it leaves everyone with scars, whether they're visible or not. Be kind to yourself and look after your mental health carefully. Thank you.